We all want to remain active, but sometimes nagging pain can slow us down. Our next guest is all about treating your knee or shoulder injuries before they become bigger problems. Dr. Siddharth Bola, orthopedic surgeon with ProLiance Everett Bone and Joint, is here to share his approach to treatment. Thank you so much for being here today.
Yeah, thank you for having me.
So first, I feel like we have to talk about your practice and the types of patients that you see at Everett Bone and Joint.
Yeah, I'm an orthopedic surgeon specializing in sports medicine with particular interest in knee injuries and knee joint preservation.
Ooh, okay. How long have you been doing this for?
I've been here almost 10 years.
Wow, amazing. And knees seem to be a common issue. It's not a sports injury, but my dad has had 2 knee replacements. My aunt just had one. So what are the injuries that you tend to see, though, in your patients?
Yeah, wide range of knee injuries. You can start with traumatic things like ACL tears, meniscus tears, dislocations. For those, we have great surgical treatments and non-surgical treatments. And on the other end, there's severe knee arthritis. For those patients, knee replacement works great and it's an amazing surgery. But there's a huge range of patients in the middle. And for those, we don't always have great treatment options. For example, someone that maybe had a meniscus tear years ago, treated appropriately, but then over the years has progressive pain or early arthritis. Now they can't keep up with their kids and play sports. They maybe have trouble with their physical job or they avoid that hike. These patients aren't ready for something like a big knee replacement. That's a huge surgery with a long downtime.
Yeah.
They need a more personalized approach. And for them, I look at things like a joint preservation. And that's trying to restore anatomy of the damaged areas without cutting things away and replacing with metal components.
A lot easier downtime? Like, what can you tell me about that process?
Not necessarily. Joint preservation can still be quite a big surgery. It can be a combination of things. It can be a mix of ligament reconstructions, meniscus transplant, cartilage transplant, joint realignment. So still, for the right patient, great surgery, but still a big downtime, still a long recovery. And so patients and myself have been looking for new options, quicker downtimes, but good function. And we finally have some great options.
And what are those?
Recently come available. So there's now a surgically implanted shock absorber that functions similar to like a car suspension, and it can take up to 30% of the load off the joint when walking and doing activities.
Wow, amazing.
And this is a much faster recovery. It's done as an outpatient, surgically implanted at the knee, but outside the joint, under the skin. And patients can go home same day.
Easy.
They can walk right away. They can bend their knee right away. And often people are getting back to light work within about a week or so.
That's amazing. And what does the surgical side, though, look like when it is the right call?
It's about pain, limited function, and all the non-surgical things just haven't been able to get someone where they want to be.
Okay. And are people coming in, like, how is that conversation, like that consultation before you decide this personalized approach with you?
Yeah, so people have gone through treatments usually for quite a while before they're ready for surgeries. It's rarely our first step.
And for people waiting and watching and dealing with knee pain, what should they know about getting care at Everett Bone and Joint?
Yeah, so we are part of ProLiance Surgeons. We are based in Everett, Washington, our main office. We see patients throughout Snohomish County and far beyond if they need more specialized care. We have surgeons that deal with all areas of orthopedics throughout the whole body. We have our own center where we can get patients in quickly, similar to an urgent care. We have on-site x-rays. We have a surgery center, so patients, if they do need surgeries, they can come in and see us there. They can have surgery, they can recover quickly, go home the same day to their own bed that night.
Love it. Thank you so much. This was very insightful. We appreciate you being here.
Yeah, thanks for having me.
Yes, and for more information on ProLion's Everett Bone and Joint, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by ProLion Surgeons Everett Bone and Joint.